Hello, and welcome to the Cyanokit training for the Newport News Fire Department. Before we go into the actual kit, let's do a quick review on cyanide. Cyanide is any chemical compound that contains monovalent combining group CN. Known as the cyanide group, they consist of a carbon molecule triple bonded with nitrogen. Cyanide is a toxic substance that can enter the body through inhalation, ingestion, and dermal absorption. Cyanide can be found in smoke from fires with substances containing rubber, plastic, or silk. Cyanide is also found in some chemical processes, cigarette smoke, and in the pits of fruits in the Rosaceae family. In a normal person, red blood cells carry oxygen to the cells. The oxygen then accesses the cytochrome oxidase complex, located inside the cell in the mitochondria, the powerhouse of the cell. This oxygen is utilized to make adenosine triphosphate, or ATP. ATP is used for a multitude of cellular functions, such as synthesis of proteins, synthesis of membranes, cellular movement, and cellular division. In this display you see how cellular respiration should be, with the red blood cells bringing the oxygen in and the oxygen attaching to the cytochrome oxidase complex on the mitochondria. In cyanide poisoning, the cyanide molecule attaches to the cytochrome oxidase complex instead of the oxygen doing so, because there's a higher affinity with the cyanide than the oxygen. This blocks the flow of electrons from the complex. This flow of electrons is needed for the creation of ATP. Without the creation of ATP, the cell is forced into anaerobic metabolism. This creates an increase of lactic acid, which in turn leads to metabolic acidosis. In this display of what happens during cyanide poisoning, you see the oxygen trying to be transferred from the red blood cells, but because the cyanide is present and cyanide has a higher affinity for the cytochrome oxidase complex, the cyanide attaches instead of the oxygen, blocking electron flow and inhibiting cellular respiration. Symptoms of cyanide poisoning include chest tightness, hypertension in early stages, hypotension in late stages, altered mental status such as confusion, disorientation, mydriasis, which is dilation of the pupils, tachypnea or hyperpnea in early stages, bradypnea or apnea in late stages, and cardiovascular collapse. In the hospital, when they draw labs, they'll also notice a plasma lactate concentration at or above 8 moles per liter. Other symptoms of cyanide poisoning include headache, nausea, vomiting, coma, and seizure. So what about carbon monoxide poisoning? Well, most of the patients that we are going to encounter in the field with cyanide poisoning concerns are going to be people we have recovered or rescued from a fire where carbon monoxide is also going to be concerned. So carbon monoxide poisoning and cyanide poisoning can occur together in smoke inhalation patients. And both conditions have some of the same overlapping symptoms. Providers should consider treating for both if suspected. Other medical interventions should not be overlooked, such as oxygen therapy, airway management, cardiac monitoring, vascular access, and spinal management. Here we have a Venn diagram showing the symptoms seen with cyanide poisoning and those seen with carbon monoxide poisoning, as well as the symptoms common to both, such as headache, nausea, vomiting, confusion, dyspnea, coma, and seizure. So what is a cyanide kit, or Cyanokit? Cyanokit is used in the treatment of cyanide poisoning. It is a brand name for the medication hydroxycobalamin. Hydroxycobalamin is a substrate of vitamin B12 made by bacteria. It is also sometimes known as vitamin B12A. Now there are some precautions when using this kit. Contraindications include an allergy to hydroxycobalamin or cyanocobalamin. pregnant patients, there is a concern hydroxycobalamin may cause fetal harm. The risk of fetal harm should be weighed against the problems or condition of cyanide poisoning, which is going to be worse for the patient, the cyanide poisoning, or the fetal harm possibly caused by hydroxycobalamin. That's something you're going to have to consider on a patient-by-patient basis. Hydroxycobalamin is not safe for breastfeeding. Mothers who have been given this medication should consult their physician before resuming breastfeeding. There have been no safety or efficacy studies done with pediatrics, so if you do have a pediatric patient with possible cyanide poisoning, consult medical direction before administration. Other precautions include the allergic reactions that may happen that have been seen with other patients, such as anaphylaxis, chest tightness, edema, urticaria, pruritus, which is itchy skin, rash, dyspnea, and angioneurotic edema. There have been other adverse reactions that have occurred in 5% or more patients treated with this, including transient chromaturia, which is the discoloration of the urine, and that's going to be a big reaction you're going to see with these patients. This medication is excreted through the urine, so patients will see a dark red. We will see dark red urine after this medication has been given. They're also going to possibly notice erythema, which is skin reddening from capillary dilation, rash, predominantly in acneiform, increased blood pressure, nausea, headache, a decreased lymphocyte percentage, and redness in the injection site, or reaction in the injection site. You may also notice an increase in blood pressure when this medication is used. It's been seen the patients have systolic blood pressures at 180 millimeters of mercury or higher, or diastolic pressure of 110 millimeters of mercury or higher. So how does the Cyanokit fit into this equation? Well, one molecule of hydroxycobalamin has the ability to deactivate one molecule of cyanide. The cyanide has a higher affinity to the hydroxycobalamin than the cytochrome oxidase complex, and will detach from the cytochrome oxidase complex and bond with the hydroxycobalamin to form cyanocobalamin. When this process happens, it will strip the hydroxy portion of the molecule off, and the cyanide portion will attach. Cyanocobalamin is a form of vitamin B12 and is excreted through the urine. This is when they're going to see that dark red urine. Normal aerobic metabolism can resume after the cyanide has been removed from the body. Back to the display we had earlier, you see how hydroxycobalamin comes in to the cytochrome oxidase complex that has cyanide attached. Again, the cyanide prefers the hydroxycobalamin, so it will detach from the cytochrome oxidase complex, strip off the hydroxy portion of the molecule, and attach, becoming cyanocobalamin. In this display of molecules, on the left you'll see the hydroxycobalamin along with the highlighted hydroxy portion, and on the right you'll see the cyanide portion attached to it after it has stripped the hydroxy portion. Administering the Cyanokit. And the Cyanokit is going to have several tools with the actual medication, including a quick reference guide for use in the field. In case you forget how to set this up, there is a reference guide to show you step by step what to do. It also has a sterile vented intravenous infusion set. It's a 20 drop set with a vented portion. You're also going to have a sterile transfer spike and one 250 milliliter glass vial containing 5 grams of lyophilized hydroxycobalamin for injection. You're also going to need IV access to the patient, of course, since this is an IV medication. You'll also need a bag of saline, 0.9% saline, and of course, dealing with your patient, you're going to need your PPE. Now, set up for administration. First, you're going to have to remove the caps from both your saline bag and your medication vial. There's going to be a gray plastic cap that's on the vial of hydroxycobalamin that needs to be removed. You're then going to take your transfer spike and access your IV bag like you would your regular IV drip set. You're going to use the other end of the transfer spike to access your medication vial, going through the plastic where the cap was protecting earlier. You're going to transfer saline from the bag into the vial. This is to reconstitute your drug. You're going to need to squeeze your bag of saline to get the transfer, as the vial itself is not vented. 200 milliliters of saline is needed for reconstitution. There's a line on the label for the vial itself. You see the fill line here in the picture. That will show you when you get to the required amount of saline for reconstitution for that concentration. Now the vial is going to be, you're going to need to rock the vial back and forth or invert it for at least 60 seconds. This is going to properly mix and reconstitute your medication for usage with the saline. Please don't shake this vial, as this is going to create bubbles and create issues when you try to administer it to your patient. For administration to your patient, you're going to take your 20 drip a minute IV set, the Bennett set that came with your kit, and you're going to spike it into your vial. Then you're going to hang it. There is a cardboard loop on the Cyanokit, as you can see in the picture, that you can hang like you do the saline bags on regular calls. Then you're going to flush your line. You'll connect with your IV access on the patient and administer 5 grams of hydroxycobalamin in over 15 minutes. You'll notice in the picture this medication is a very dark red. So where are these Cyanokits located? Cyanide exposure patients are not a very high frequency call, so these are not on the medics. Each EMS supervisor, who should be on fire calls anyway, each truck has 2 of these kits on their vehicle, and the supervisors are going to replace these kits at Riverside Regional Medical Center after they've been used. Thank you for watching this training presentation regarding our cyanide kits. If you have any further questions, please either ask your EMS supervisor, or you can check out one of these websites. Cyanokit has a pretty detailed website at www.cyanokit.com. It includes their own presentation on the uses of this medication, along with brochures and a printable administration guide in case you want to look at it before you get to it. Thank you, and stay safe.